Hi everyone, my name is Sandeep Patil and today we are discuss on the pharmacovigilance terminologies. So first of all, we discuss about the vaccine pharmacovigilance. In a vaccine pharmacovigilance is a science and activity related to the detection, assessment, understanding and prevention of side effects and other drug related problems following by the immunization and other vaccines or immunization issue to the prevention of untoward effect on the vaccine. Then followed by concept 0 or a date 0 or a initial receipt date or awareness date. The original date, the company employee or the company or its client or a partner who receive the case and report in a portal of awareness with a four minimum criteria, and that's age, medicinal product, reporter, and one adverse event. Minimum criteria for reporting is a patient, identifiable patient, included age, name, address, and patient hospital number. Another one is a suspected medicinal product and a identifiable reporter and one adverse event, at least one adverse event which happened to the patient. So what is the adverse event? Adverse event is nothing but the unintended and untoward medicinal occurrence in a patient or a clinical investigation subject to whom pharmaceutical product has been administered. Another one is the adverse reaction. Adverse reaction is nothing but the unwanted, unintended, untoward effect pharmaceutical product may have. There is difference between the adverse event and adverse reaction. That is, adverse event is a cause, its relation with the causable reason, and adverse reaction, it does not have a causable relation with the drug. Unexpected adverse reaction. Every pharmaceutical company insert the leaflet in a carton. They include all the information regarding the adverse event and adverse reaction, but sometimes the adverse reaction occurred to the drug it does not mention to the in a leaflet, so that's the unexpected adverse event or reaction. Serious adverse event. Serious adverse reaction depend on the following criteria: result in a death, is life threatening, if patient is administration in a hospitalization for prolonged time, or the result in a disability or incapacity or birth defect. And this is the you can say it criteria of an adverse event which is serious or non-serious. Severe event. Severe is a term which are used to describe the intensity of medicinal product. They are mild, moderate, and severe. Spontaneous report or solicited reports, where the unsolicited communication by a regulatory authority, healthcare professional, patient, consumer, or any other relative who reports the adverse event or adverse reaction of the drug uh, by which does not have any study on the that medicinal product, followed by the solicited report, in which the a report from the regulatory authority, SCA, patient or consumer in and any others related with the administered the patient report the adverse event or adverse reaction, but it is a technically study on that particular reaction. Literature, man of when drug launch in a market, most of the people's monitoring on drug and continuously study on that drug, they got information about that drug have a different adverse event or a adverse reaction. So they don't consult with the company, they direct publish in a literature or any other publications. So another one is reportability. Any case that meets the criteria, so it should be reported in a ICR. Suspected and non-suspected drug. Any drug which may potentially be implicated in the etiology of an adverse event. Non-suspected drug, is also known as a concomitant drug. That means you doesn't know the adverse reaction happens by that the particular drug. In case of the other drugs are taken by the so the adverse events will occur by that particular drug. This is the non-suspected drug. Medical history, in which the medical history scheme will only need to list the relevant medical history and concomitant medication, study indication that are clear from the study title. Also known as the also they got the information about the medication history of the patients, and just suicide attempt case. Some of the drugs are motivate person to do suicide attempt. So that's that are the drugs which are casually used for the treatment, but they are motivate to person to take a suicide attempt. So placebo. What is a placebo? Placebo is a pill or a tablet or any you can say the powder which does not have any therapeutic effect, but it is only customer satisfaction who think the drug cure his disease, but only this is that's what do you say, placebos perform on the basis of that customer mind. The divert that mind, he think like he now he's think like he's now feel better than the absent case. So blind blind case, in which the doctors and patient does not have which drug and how much dose they are taken for the treatment. International birth date. When the FDA gives approval to the drug and it's introduced in a market authorization, that's the date, international birth date of the drug. Data lock point, where data lock point is a cutoff date for the company to submit all the data before that day. Signal detection, where the report is received, various types of reports are received to the PV they find out the particular adverse event which occurs most of the times, just like any drug are taken, and headache, nausea, vomiting, these are the side effects of that particular drugs. And in case, mm, 80% of the headache should be reported. So the that are the headache is a signal that cause many times to the patient. So you have to cure the headache side effect firstly, because of it's mostly happens to the mostly time. So that is the signal detection. This is the overall summary of the pharmacovigilance terminologies. That's it. Thank you.